The Oregon Secretary of State says more needs to be done to address the problem of domestic violence in Oregon. It is a big problem. According to the Secretary of State, more than 1 in 3 people in Oregon will become victims of domestic violence in their lifetimes. Auditors shared some real sobering statistics. 1 in 5 homicides nationwide stem from domestic violence. 393 fatal domestic violence incidents left 532 people dead in Oregon over the 10 years from 2009 to 2019. And in 2019, 15 out of Oregon's 36 counties had at least one domestic violence incident that left someone dead. It affects all levels of income, of course, including those who are homeless. The auditors point out that 32% of adults in families with children in homeless shelters had domestic violence. Another 15% of people were currently leaving a violent home. The Secretary of State's audit took a look at how Oregon is responding to domestic violence, and they found that services are fragmented throughout the state and service providers are not getting the resources that they need on a consistent basis. The Secretary of State's office says Oregon lacks a centralized, statewide response to domestic violence, and the approach right now is just too siloed. They urged Oregon state leaders to take action to bring all that together. We talked today with Emmy Ritter, the executive director of Raphael House. That's an organization that provides shelter and services to victims. She says, yes, our state's response needs to start focusing on long-term help.
For survivors and their families, we have found that there's real success when we can be a touchstone for survivors. When they're in crisis, when they just need a support group, when they need a referral to somewhere else, that we've really seen people be able to take off with safe and stable housing and lives and thriving families. So long-term supports are essential. The systems don't pay for that, though. The system, the federal grants, the statewide grants, typically pay for the crisis management of domestic violence. So we're always in this loop of responding to crisis and violence.
The audit also found that under the current system, service providers are not getting the funding they need, not getting the money, and that they're spending too much time applying for grants and doing administrative work. Ritter agreed. She told us the infrastructure to create a statewide task force is there, but it needs to be funded in a more stable way.
The statewide funding can't be one-time funding. It really needs to be permanent, long-term, consistent funding. And I really think that if we had the stability of state funding, all the nonprofits throughout the state, we would be able to address some of these larger issues, really work on the prevention work and work together from a statewide perspective.
The audit noted that Oregon's systemic issues, including a lack of affordable housing, lack of mental health care, lack of child care, all contribute to this problem, and that the lack of those services makes it harder for victims to leave and start their life over, and that those issues are all amplified for people with marginalized identities like BIPOC and LGBTQ people.